Okay, good morning to everyone. The today's topic for discussion will be age estimation by dental examination. This is a practical topic. This carries around 10 marks for your practical exams. Okay, so this is a major topic which will carry the maximum marks. So it will be 10 marks for this. So for dental examination, so normally we provide you a child. So we just tell you to do the dental examination of the child and give the age of the child. So, but now what we have done is instead of giving you the child, we are giving you a mandible, and we tell you to estimate the age of the mandible and give your opinion based on that. Okay. So the performer for this age estimation by dental examination, it is there in your records. So once you come back to the college, we will tell you how to fill up the performer. Okay. And for the exam, so it should be the same. Whatever the performer is there in your records, that has to be mentioned. Okay. For exam, we will just give you a dental. We will give you a mandible, and we will tell you to examine the mandible and give the age of the mandible. Okay. I think this part, the initial few slides I had shown you in the last class. So I'll just brief the initial few slides. Okay. So coming to the introduction, the eruption pattern of the teeth, it follows a sequential pattern which is used for estimation of the age. Age can be estimated based on the eruption pattern of the teeth up to 25 years. So the third molar, that is the last molar, normally it erupts at the age of 17 to 21, and in few textbooks it is up to 25 years, the third molar. So up to the age of 25 years, you can just see the teeth and give the age of the person. So the eruption pattern of both temporary and permanent teeth is used to estimate the age. After 25 years, the age can be estimated by Gustafson's method. So Gustafson's method, it is very important. So it will be repeatedly asked in the exam. So you should know what is Gustafson's method. So Gustafson's method, we mainly use it after 25 years for estimation of the age. So I'll tell you in detail what is Gustafson's method. So before starting, you should know what are the parts of the mandible. So I think everybody know what are the parts of the mandible. So first, from the top, you have the condyloid process, you have the coronoid process, and these two processes are very important with respect to the forensic aspect because based on the level of the coronoid and condyloid process, you can estimate what is the age of the person. So normally in infancy, the condyloid process will be at a lower level than the coronoid process. And as the in adult or in middle age, the condyloid process will be at a higher level than the coronoid process. And again in old age, it becomes the same like infancy where the condyloid process is lower and the coronoid process is at the upper level. So that is the importance of this condyloid and coronoid process. Okay, this will help you to tell the age approximately, not the exact age you can't make out. Whether it is an infant or a middle age or an old age, you can make out based on the condyloid and coronoid process. The next you have the mental foramen. So even this mental foramen is very important. It can tell you the age of the person. So normally this mental foramen will be towards the lower jaw. Okay, you have the angle of the mandible here, the lower end of the mandible. So in infancy, it is present just below the, just towards the lower angle of the mandible. So that in infancy, but in middle and in middle age or in adult, it is present at the center, the mental foramen. And in old age, it is present towards the alveolar sockets, that is towards the teeth, it is very close towards the teeth. So based on the mental foramen position, you can also tell what is the age of the person, whether it is an infant one or whether it is a middle age or whether it is an old age. So this can be told based on the mental foramen. Next, you have the ramus of the mandible and you have the body of the mandible. So these are the different parts of the mandible. So I'm just highlighting the only important parts which we deal with the forensic medicine. So next important thing is the differences between male and female mandible. So whenever you get mandible or whenever you get age estimation for dental examination, this is a stock question which will be asked. What are the differences between male and female mandible? So in general, the male mandibles are usually larger and thicker and the female mandibles are usually smaller and thinner. This applies to all the bones. So all the bones, the male bones are usually larger and thicker and the female ones are smaller and thinner. And the chin is usually square shape in case of males and in females it is rounded. And the body height is nothing but here you can see. So the symphysis menti you have, no? So that there comes the body height, the vertical part, we call it as the body height. So the body height, it is greater at symphysis in males and in females it is smaller at symphysis. And next is the ascending ramus. The ascending ramus, it has a greater breadth in case of males and in females it has a smaller breadth. So ascending ramus you can see in this slide. So this is the ascending ramus. Between the body and the ramus, you have a junction. So that is the ascending ramus. In males, it has a larger breadth. In females, it has a smaller breadth. The next is the angle of the body and the ramus. So the angle between the body and the ramus, we call it as gonion. So gonion, it is less obtuse in males and it is more obtuse in females, and it is more prominent in males and it is less prominent in females, and it is everted in males and it is inverted in females. So these are the differences between male and female mandible. And the condyles are larger in males and it is smaller in females. And even the mental tubercle. So the mental tubercle is larger and prominent in males and in females it is insignificant. So these are the differences between male and female mandible. So next coming to the age. So now you have studied what is the, how to identify the gender in case of a mandible. The next we will go for the age. So the alveolar cavities which contain teeth are formed around 4th or 5th month of intrauterine life. So that is whatever the germ cells for the temporary and permanent teeth. So these are formed at 3rd to 4th month of intrauterine life. At birth, the rudiments of all temporary teeth and of the first permanent molar is found in the jaw. So it means the same. So normally at 9th month of intrauterine life, you can see the rudiments of all the temporary teeth and the first permanent molar. You don't have the rudiments for the second and third permanent molar at the time of the birth. You have the rudiments of only the temporary tooth and the first permanent molar at the time of the birth. The teeth calcify from crown to neck to root. This I have told you in the last class. So it is not that the root is formed, next is the neck, next is the crown. It doesn't happen like that. First is the crown which gets calcified. Once the crown is completely formed, you see the neck, and last is the root. Okay, the calcification takes in this order. Next, what do you mean by eruption? So everybody, we tell that whether the third teeth is erupted or whether the premolar is erupted. So what do you mean by eruption? So eruption is defined as the superior part of the crown of the teeth appearing level with the surface of the alveolar bone. So alveolar bone is nothing but the maxilla and the mandibular bones. So once you tell the teeth is erupted, it means it should be at the level of the alveolar bone. Okay. So that is called as eruption. In both temporary and permanent teeth, dentition occurs earlier in the lower jaw. So normally the eruption is earlier in the lower jaw except lateral incisor. Okay, any lateral incisor, the eruption is first in the upper jaw. Later it is at the lower jaw. All the other teeth, the eruption is earlier in the lower jaw and followed by the upper jaw. Okay, the one exception is with related to the lateral incisor where it erupts first in the upper and later in the lower jaw. Next, the wisdom teeth erupts first in the lower jaw. Wisdom teeth is nothing but the third molar. So normally the eruption of wisdom teeth is first in the lower jaw and on the left side. Okay, this is the first teeth which erupts and later all the other wisdom teeth will erupt. And eruption is not always bilaterally symmetrical. Okay, it is not that on both the sides it erupts at the same time. So it is not bilaterally symmetrical. The tooth eruption in females is 1 year earlier than that of males. In females, it is very much earlier. It is around 1 year. And you see mixed dentition. Mixed dentition is nothing but where you have both temporary and permanent teeth in the jaw. So this is seen up to 12 years. So up to 12 years, you see both temporary and permanent teeth. So normally the temporary teeth will fall and at that side the permanent teeth will erupt. So this happens up to the age of 12 years. After 12 years, you see only the permanent teeth that are present in the jaw. If you have any doubts, you can just message me, okay? So these are the parts of the teeth. So this is very important. So you have the crown, that is the upper part of the teeth, the neck and the root. So once you take the cross section of that, you have the enamel. So whatever we see, that part is called as the enamel of the teeth. And next, inside the enamel, you have the dentin. Just below the dentin, you have the pulp cavity. So this pulp cavity is very important. You can do the ABO blood grouping from this pulp cavity. Also do the DNA analysis of the person if the pulp cavity is intact. And next, the teeth, it gets attached to the bone through the periodontal tissue. Whatever the junction between the teeth and the bone you have, that is called as the periodontal tissue, or it is also called as periodontal membrane. And next you have the root of the teeth. Okay, so these are the different parts of the teeth. So the next we will go, what are the types of teeth, how it is aligned. So this everybody know, you have the central incisor, the lateral incisor, the canine, the premolar 1, 2 and molar 1, 2 and 3. You don't have premolars in the temporary tooths. You have only you have premolars only in the permanent teeth and you don't have it in the temporary teeth. So the next we will see how to differentiate between different types of teeth. So first you have the incisors. So the incisors, the crown is shaped like a chisel and the root is single. So normally the incisors, the canines as well as the premolars, the root is they have a single root, and the canine is usually a little larger than the incisor, and even here the root is single but it is larger and thicker. And the premolars, they are also called as bicuspid teeth because they have two cusps. Once you see the premolars, you can see two cusps. So the root is single, but maybe double in few members it will be doubled. And molars are usually larger and it is cubical in shape and it has 3, 4 or 5 cusps. The upper molar it has 3 roots and the lower molar has 2 roots. This is very important. So normally the upper molar will have only 3 roots and the lower molar will have 2 roots. So you can see here how the premolars are present. So how the occlusion surface of the premolar is there and how the molars are there. Okay. So the premolars will have 2 cusps while the molars can have 3 to 4 to 5 cusps. So these are the root. So you can see the incisors, it has a single root and even the canine has a single root. The premolar sometimes it can have 2 roots and the molars which have 3 roots. Okay. Just wait, no? There is something happening. Just wait. So the next we will go for the temporary teeth eruption. So the temporary teeth are also called as deciduous teeth or milk teeth, and they are usually 20 in number. You have 4 incisors, 2 canines, and 4 molars. So you have only 2 molars. Okay, on each side you have 2 molars, and there are no premolars in the temporary tooth. And in some conditions, that is, if the child is suffering from rickets or hypothyroidism, the dentition can be delayed. And in syphilis, you can see the teeth can be present even at the time of birth. So these are the two conditions where early dentition can occur and even late dentition can occur. So this is the time of eruption of the temporary tooths. So as I told you, the lower teeth will erupt first and later is the upper teeth. So the upper central incisor will erupt at 7 to 9 months. I think everybody knows this. During your bone examination, this has been told to you. So I'll just be little fast. So the easy way to remember is just remember the lower central incisor is at 6th month. The upper central incisor is at 7th month. Next is the upper lateral incisor which erupts at 8th month. Lower lateral incisor is around 9 to 10 months. So easy way to remember is like that. And the canine is 1.5 year. First molar is 1 year and the second molar is at 2 years. Okay, so this is a way to remember the teeth eruption in case of temporary tooths. So normally the canine will erupt little late. Okay, so after the eruption of the first molar, you see the eruption of the canine. It is little bit delayed. So the canine will erupt after first molar. So this is the time of eruption of the temporary tooths. So here it is just the figure showing you the different teeth when does it erupt. The central incisor 7 to 9 months. The lateral incisor, this is approximately they have given it 7 to 9 months. The canine 17 to 18. The first molar is at 1 year. The second molar is at 2 years. So next is the eruption of the permanent teeth. So the permanent teeth eruption, the first permanent teeth that erupts is the first molar. Okay, so that erupts at 6 years. Later is the central incisor which erupts at 7 years. The lateral incisor 8 years. The canine is at 11 years. Even here the canine will be little late. Okay. The premolar 1 is at 9 years, the premolar 2 is at 10 years, and the molar 2 is at 12 to 14 years, molar 3 is at 17 to 25 years. So this is the pattern of eruption of the permanent teeth. So normally the temporary teeth will fall and in that place the corresponding permanent teeth will erupt. Except when the temporary molars fall, the premolars will erupt. Okay, so this is a bit little confusing. So you can just remember whenever the central incisor or the lateral incisor or the canine falls, the temporary central incisor, lateral incisor and the canine, whenever it falls, the permanent incisor and canine will erupt at that place. Okay, so this is clear with incisor and canine. So what happens to the temporary molars? So whenever the temporary molars fall, in that place the premolar will erupt. The molar doesn't erupt at the place of temporary molars. It is only the premolar which erupts at the place of temporary molar. Okay, this is one exception. So why this happens is whenever you see the dentition, so all the temporary teeth are present in the jaw at the age of 2 years. At the age of 6 years, you see the permanent molar which erupts behind the temporary molar. The temporary molar is still present in the jaw and the permanent molar will erupt behind the second temporary molar. Okay, so the permanent molars, whatever 1, 2 and 3, permanent molar 1, 2 and 3, they do not erupt at the site of temporary molars. Okay, so whenever the temporary molars fall, the permanent premolars will erupt. Okay, so I think it is clear now. So this is a figure showing you again the different teeth when it erupts in case of permanent. So what are the differences between temporary and permanent teeth? So normally with respect to the size, the temporary teeth are usually smaller, lighter and narrower. The permanent teeth are heavier, stronger and broader. Okay, the permanent teeth are usually little bigger when you compare it with the temporary teeth. And the direction, anterior teeth are usually vertical in case of temporary, and in permanent teeth they are usually inclined to little forward. And the crown in case of temporary teeth, it is china white in color, while in permanent teeth the teeth color is usually ivory white, and the neck is more constricted in case of temporary, and in permanent it is less constricted, and the roots are usually smaller in case of temporary, that is the molar roots are usually smaller, and in permanent the roots are usually larger, and ridges are seen at the junction of crown with the frank present, and there are no ridges in case of permanent teeth. So these are the differences between temporary and permanent teeth. So why this is important is whenever you see the mixed dentition, I told you till the age of 12 years you will have the mixed dentition. So whenever both temporary and permanent teeth are present in the jaw, you should find out what is the age of the person. So you should not get confused with the temporary teeth. So once you know the differences between the temporary and the permanent teeth, it is very easy to tell which is temporary and which is permanent teeth. So that is the reason you should know the difference between the temporary and permanent teeth, how it looks. Okay. So the next we will go, this I told you how to, apart from the finding out from the teeth, the age of the person, you can also use a few other things in the mandible and tell what is the age of the person. So first is the body. So the body of the mandible in infancy it is shallow, in adult it is thick and long, and in old age again it becomes shallow. Shallow is nothing but it is very small. Okay. So whenever you see the body in case of infants, it is very small when you compare it with that of the adult. And the ramus, it is short and oblique, forms obtuse angle with the body in case of infancy. In adult, it is less obtuse. So in infancy, it is more obtuse. In adult, it is less obtuse. And in old age, again, it becomes obtuse. So normally in infancy and old age, the findings are usually the same. Okay. Only in adult, it changes. And the mental foramen, it opens near the lower margin of the mandible. And in adult, it opens between the upper and the lower margin. And in old age, again, it opens near the alveolar margin. Okay. That is towards the teeth, it opens. That is the mental foramen. Next is the condylite process. Even this I have told you. So the condylite process is at a lower level than the coronoid process in case of infancy, and in adult it is elongated and projects above the coronoid process. That is, it is above the coronoid process in case of adult. And in old age, again it is at a lower level than the coronoid process. So these are the major differences between the with respect to the age in case of infancy, adult, and old age. Okay. Apart from the teeth, you should also see the mandible, how it looks, and you can also tell the age of the person. So in this diagram, you can see it is not so clear, but you can have a rough look of this slide where you can find out the differences. See the top on the left side, you have the infant one. So you can see the coronoid process is at a lower level than the condylite process. Okay, and even in the child. So here, even here, you can see the coronoid process is at a higher level than the condylite process. And next below that, you have the adult one. So even in the adult, you can see the condylite process is at a higher level than the coronoid process. And in the old age, again, it becomes like the infancy where the coronoid is at a higher than the condylite process. So this in this slide, you can tell based on the, and even you can also see the mental foramen, where the mental foramen is located in infancy, in middle age, and in old age. Okay. So that the marking is not so very clear, but you can see the foramen. You can see a dot in the body of the mandible. So that is a mental foramen. In infancy, it is present towards the lower jaw. In adult, it is present at the center, and in old age, it is present towards the alveolar process. Okay. So this picture will clearly tell you how to differentiate between infant, child, and old age. So even this is the same one where you can tell based on the condylite and coronoid process. So this is very important. I think this none of you answered in the practical internal assessment. So you should know what is superadded tooth, what is successional tooth, and what is impacted tooth. So superadded tooths are nothing but are those which do not have their deciduous preceders. So as I told you, whenever the temporary tooth fall, the permanent tooth will erupt at that site. So there are few teeth where you don't have the this doesn't occur. Okay, I told you the permanent three molars, what first, second, and third molar, they don't erupt at the site of the temporary tooths. So these three molars are called as superadded tooths. Okay, so they erupt behind the temporary tooth. All permanent molars are superadded tooth. The superadded permanent teeth are six in each jaw. That is three on each side. So you have totally six in each jaw. So they are called as superadded tooths. The next is the successional tooth. So whatever the remaining tooths are there, which erupts at the site of the temporary tooth, so they are called as successional tooths. The teeth are those that erupt in place of deciduous teeth. There are 10 in each jaw. So these are nothing but the central incisor, the lateral incisor, the canine, premolar 1 and premolar 2. So there are totally 5 on one side and totally 10 in each jaw, and totally you have 20 successional teeth. Okay, and premolars erupt in place of temporary molars. And the next one is the impacted teeth. So impacted teeth is nothing but where there is no space for the eruption of the teeth. So it just remains within the bone itself. So they are called as impacted teeth. Due to inadequate jaw space behind the third molar, uh, never erupt in the oral cavity, particularly the mandibular third molar. So this impacted teeth you most commonly seen at the third molar. Okay, so where there is no eruption for the third molar and it just gets impacted within the bone. Such trapped teeth are called as impacted teeth. Okay. The next is a mixed dentition. I told you where you see both the temporary and permanent teeth. It is seen up to the age of 12 years. So normally we tell it is 6 to 11 years. You can also extend it up to the age of 12 years. So these three things are very important. What are superadded teeth? What is successional teeth? What is impacted teeth? Okay. So the next most important one is the Gustafson's method. So this will be repeatedly asked for your theory and practical, and it is very, very important. Okay. What is Gustafson's method? You should know Gustafson's method whenever teeth is asked to you. Okay. So Gustafson's method is nothing but based only on the eruption of the teeth, you tell the age of the person. So there are other few criteria where you can see the teeth and tell the age of the person after 21 years. Okay, because up to the age of 21 years, based on eruption, you can tell the age. But after 21 years, you can just take the teeth. This is only done in case of dead individuals, not in live. Okay, Gustafson's method is mainly done in a deceased person, and it is not done in a live person. So you should just take the teeth and subject it for few testing. Okay, then later you can make out what is the age of that person. So the age estimation of adult over 21 years depends on physiological changes in the dental tissue. So after 21 years, you have lot of changes that occur in the dental tissue, and based on these changes, you can identify what is the age of the person. So what are the criteria in Gustafson's method? So the easy way of remembering Gustafson's method is you can remember APSRTC. APSRTC, that is Andhra Pradesh State Road Transport Corporation. This is the mnemonic which we use. Okay, you can just remember this mnemonic. So A stands for attrition, P stands for periodontosis, APS, S stands for secondary dentin formation, R stands for root resorption, T stands for transparency of root, and C stands for cementum apposition. Okay, so this is the easy way of remembering the Gustafson's method, APSRTC. So now we will individually study what are these things. So this Gustafson's method is commonly asked for 4 marks. Okay, so you should know what is Gustafson's method. These 6 criteria are very important in Gustafson's method. So the first one is the attrition. So what do you mean by attrition? So because of this constant mastication, that is because of constant chewing, so the upper layer of the teeth, it gets eroded. Okay, so that is called as attrition. So attrition is due to wear and tear from mastication. The occlusion surface of the teeth is destroyed gradually. First involves the enamel and then dentin, and at last the pulp is exposed in old age. So that is called as attrition, where you can see because of constant mastication, this happens. Only this is a gross finding in case of Gustafson's method. All other things are all microscopic. Okay, the remaining five criteria are all microscopic. Only this is the gross finding which you can see it in the Gustafson's method. The first one is the attrition. The next is the periodontosis. So periodontosis is nothing but normally there is regression of the gums and the periodontal tissue surrounding the teeth takes place in advancing age, gradually exposing the neck and the root. So the periodontosis is nothing but in this diagram you can see. So the top one is the healthy teeth where you can see the gums are healthy and even the teeth is very healthy. And in the lower one you can see the gums are little at a lower level. Okay, so this is called as regression of the gums. So once this regression happens, normally only the crown of the teeth is visible. You don't see the neck as well as the root. So once the regression happens, you can see the crown to some, you can see the neck to some extent, and if this regression progresses, you can also see the root and the teeth will fall down. So that is called as periodontosis. Okay. So normally this periodontosis is most commonly seen in poor oral hygienic condition. So in those cases you see this periodontosis. The next is a secondary dentin formation. So they develop from the walls within the pulp cavity. So you can see the pulp cavity here. So normally here you can see the deposition of the secondary dentin. So once this happens, there is decrease in the size of the pulp cavity. So first it is deposited in the pulp chamber and gradually extends downwards to the apex and completely fills up the pulp cavity. So that is called a secondary dentin. Even this is microscopic finding. You should just take the teeth, take the cross section of the teeth and see for the secondary dentin formation within the pulp cavity. Okay. And the next is a root resorption. So root resorption is nothing but it involves both cementum and dentin, which shows characteristic sharp grooves. So in the root you can see there are characteristic grooves which is seen in the root, and absorption of the root starts first at the apex and extends upwards. So first it is seen at the apex of the root and next it extends upwards. It occurs in the late age. Normally this root resorption is usually seen after 60 years. Okay. So by this you can also tell the age of the person. The next most important one is the transparency of the root. Transparency of all these six criteria in Gustafson's method, the transparency of root is more accurate. Okay, so whenever Gustafson's method is asked, they will ask you which is more accurate of all this. So the transparency of root is more accurate. It is not seen until 30 years of age. The canal and the dentin are filled by minerals, so they become translucent. As the age advances, the dentin becomes transparent due to rarefaction. So the normally because of calcium deposition, the root is not transparent. But as the age advances because of osteoporosis or because of less of calcium, the root becomes transparent. So that is called as transparency of root. The transparency of root occurs from below upwards. Okay, so it is from below upwards in the lower jaw and from above downwards in the upper jaw. So it is more reliable of all the six criteria. The next one is the cementum apposition. The cementum is nothing but what you have the covering over the teeth, and normally the teeth it gets attached to the alveolar bone through a structure called a cementum. Okay, so this cementum it increases in thickness due to change in the tooth position. Secondary cementum deposition takes place throughout the life, and there are incremental lines which are formed. The age can be counted by counting the number of the incremental lines from the neonatal age. So normally this cementum you can see it at the root. Okay, here you can see in the diagram. So this cementum it gets deposited and there are formation of incremental lines. So you can just count how many incremental lines are there from neonatal age and you can tell what is the age of the person. So that is called as cementum apposition. So before the teeth is extracted from the body, the attrition and periodontosis is estimated by Gross. So attrition and periodontosis, both you can tell by just seeing the teeth itself. So first this has to be done, and the teeth is cut on both sides for about 1 mm and placed on the glass slab and looked for transparency of the root microscopically. The anterior tooth are more suitable than the posterior teeth. So the Gustafson's method, normally we do it with the incisor teeth. Okay. So molars, normally we don't take it for Gustafson's method estimation because it is very difficult to estimate from the molars. It is only the anterior tooth which are mainly used for doing the Gustafson's method. The merit decreases from incisor to premolars, while third molar is quite unsuitable, and all the changes are absent at 15 years. So all these changes in the Gustafson's method you can only assess after 21 years, and it is absent at 15 years. And normally, how we grade this Gustafson's method is we give points. There are 0 to 3 points are allotted to indicate the degree of any of these changes. So stage 0 is where there is no change. For example, if you just take attrition, 0 means there is no attrition. And 1 means there is just beginning of the attrition. And 2 where there is an obvious change. And 3 there is a maximum change. Okay. And for all these 6 criteria, we give the staging. Stage 0, 1, 2 and 3 for all the 6 criteria, that is attrition, periodontosis, secondary dentin, cementum apposition, transparency of the root. For all these we give this staging and we just add up whatever the number you get. That is, if it is 1 plus 3 plus 2, we add up everything, and that will tell you what is the age of the person. Okay, so that is a way how we identify the age of the person. And there are few other methods how you can estimate the age of the person after 21 years based on the examination of the teeth. So that is a Boyd's method and Streak's method. So these two names you should know. What are the other methods apart from Gustafson's method? It is Boyd's method and Streak's method. So these are the stages of Gustafson's method. So A stands for attrition, S for secondary dentin, P for periodontosis, C for cementum apposition, R for root resorption, and T for transparency of root. Okay. So we just see at what stage the teeth is present and we add up all this and give the age of the person. Okay. So here in this diagram you can only see that the other things is not so clear. Okay. So the next most important one is forensic odontology. So whatever you study with respect to the teeth, so that is called as forensic odontology. So it deals with the science of dentistry to aid in the administration of justice. So we mainly examine the teeth, and that will indirectly help you in finding out the crime, or in it helps in identification, all that. Okay. So it involves the analysis, interpretation and comparison of bite marks, personal injuries and malpractice. So what and all you see when a teeth is present? So first you see for the number, the spacing. So all this can be done when you get a skull. Okay, when you have a skeleton remain of a skull with teeth intact, you can see for all these things and give your opinion. First, you see for the number of the teeth, the spacing and the situation of the teeth, and you see whether it is a temporary or permanent teeth, whether there is any decayed teeth, undersized, oversized, or any absent teeth, the general condition of the teeth, any filling, cavities, overlapping of the teeth, malposition, supernumerary teeth. Supernumerary teeth are nothing but where there are extra teeth that are present. And if there are any injuries in the teeth or any disease, and if there is any root canal treatment that is done, or if there is any oral pathology. So all this will help in identification of the person. So all these things has to be seen. So next most important one is the pink teeth. This is asked for 2 marks. Okay. So what is pink teeth is, in a decomposed body or in a skeletonized body, you can see a pink teeth which is noted especially near the gum line. So in this diagram you can see the teeth is little pink towards the gum line, and this is mainly due to the deposition of protoporphyrin. Okay, after death, the protoporphyrin gets deposited in the teeth, and which results in pink teeth, but the exact cause is not known. Okay, so the exact cause is not known. It is caused by asphyxia or carbon monoxide poisoning, but the main what is the reason for the pink teeth is not known. Okay, so some tell that it is due to deposition of protoporphyrin in the teeth, which results in pink teeth. Okay, so this you should know what is pink teeth. So, what are the medico-legal importance of teeth? So, first, the teeth, it mainly helps in identification. So, based on the gross appearance of the teeth, based on the number of the teeth that are present in the jaw or the age of the person, so it helps in identification. That is a major thing which happens with the teeth. And teeth are useful in estimating the age and gender of an individual. So, you can also identify the age of the person. You can also tell what is the gender of the person. Not only on the gross examination, even if the pulp cavity is present, you can identify the gender of the person. That is very important. And even you can also do the DNA analysis of the person if the teeth is present. If the pulp cavity is intact, you can do the DNA fingerprinting and you can identify the person. So apart from that, if there are any root canal treatment or if there are any artificial dentures that are present, and if there are any records, if there is a missing person and you have any relevant records, if the person has done any root canal treatment or artificial denture, if the records will tally, you can tell whether the missing person is the same or not. Okay, so even that helps in identification. And blood grouping can be done from cells in the pulp cavity, and loss of teeth can result in grievous hurt. So there is one clause in the grievous hurt where which states that fracture or dislocation of bone or teeth. So even that amounts to grievous hurt. And criminals can be identified through bite marks. So whenever you see the bite mark, okay, the bite marks will be present either in case of sexual offense, you can see it over the body of the victim, or if there are any footsteps which are left over, you can also see the bite marks of the person there. So even that helps in identification. And certain poisons can also be detected in the teeth. So not only in the teeth, it is mainly in the pulp cavity. Okay, so which poison can be detected is the heavy metallic poison such as lead, arsenic, mercury, antimonium. Even this can also be detected in the bone. Even in the bones, you can detect certain poisons. It is mainly the heavy metallic poisons which can be detected in the bone and teeth. And in fluorosis, you can see yellowish discoloration of the enamel of the teeth. So these are the major medico-legal importance of teeth. So whenever teeth is given to you or whenever mandible is given to you, they will ask you what are the medico-legal importance of teeth. So this has to be told. So next important one is the charting. So this is very important whenever you are writing your record. So how do you mention how the teeth is present in the jaw or how many teeth are present in the jaw? So there are different methods how to write it in the how to just mention it in the records. So first most important method is universal method. So universal method is nothing but in this picture you can see. So you have the right and the left. R is for right and L is for left. So they just mention it as 1, 2, 3, 4, 5, 6, 7, 8. Okay, till 8 it is on the right upper, and 9, 10, 11, 12 is on the left upper, till 16 and come below, and 17, 18, 19, 20 and again till 32. So this is a universal method. Totally you have 32 permanent teeth. So this is a universal method how to represent it in the chart form. Okay, this method we don't follow it now. So normally dentists they follow either the universal method or FDI method. Okay, it depends on the doctor. So there are different methods that are followed, and this is called as the universal method. The teeth are numbered 1 to 16 from upper right to upper left, and 17 to 32 from lower left to lower right. Okay, so this is the universal method. This method we don't follow it in the records. Okay, I'll tell you which method you are supposed to write it in the record. The next is a Palmer's method. Palmer's method, it is in this diagram you can see it is 1 to 8 on the right, left, upper and lower. Okay, 1 to 8 is nothing but 1 is for central incisor, 2 is for lateral incisor, 3 is for canine, 4 is for premolar 1, 5 premolar 2, 6 molar 1, 7 molar 2 and 8 molar 3. Okay, so this is a way it is done in case of Palmer's notation. Okay, this is for permanent teeth, and for temporary teeth, they mention it as A, B, C, D, E. A is for central incisor, B for lateral, C for canine, D for molar 1, and E for molar 2. Okay, so this is a way that is done in Palmer's notation. So these are different methods. Even this Palmer's method we don't follow because it is very difficult to tell which is upper and which is lower. Okay, so that is a way we don't mention this. The most important one is the FDI method. Okay, head rub system is same like Palmer's. The only one difference is they add a plus sign and minus sign. So the plus sign is added to the upper teeth and minus sign is for the lower teeth. Okay, that is +1, +2, +3 is for the upper teeth. -1, -2 is for the lower teeth. That is the head rub system. Even this we don't follow. The one we follow is the FDI method, that is Federation Dentiture Internationale. You should know what is the full form of FDI. So it bears a slight resemblance to Palmer's system in that both utilizes the same number, but the FDI system substitutes a number for the quadrant side, and that number is placed before the teeth number. So I'll just tell you what is FDI method. So this is the FDI method. So in FDI method, this is for the permanent teeth. So just remember, it is right then left. Okay. So it is 1, 2, 3, and 4. So on your left hand side, whatever is there, that is 1. And left hand side, the upper one is 1. And on the right, it is 2. And again, right lower is 3. And left lower is 4. Okay. So it is 1, 2, 3, and 4. And you add up 1, 2, 3, 4, 5, 6, 7, 8 just next to the number. Okay, if it is 1, 1, it is left. It is left upper central incisor. 1, 2 is left lateral incisor, upper lateral incisor. 1, 3 is left upper canine. Okay, so you should not read it as 11, 12, 13, 14. It is 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6. That is for the upper one. And on the left side, and on the right side you have 2, 1, 2, 2, 2, 3, 2, 4, 2, 5. So this is a way it is done in FDI method. Okay, so for you on the left hand side, whatever is there, that is for the right. Okay, so here it is left hand side, it is right, and right hand side it is left. Okay, it is reverse on your screen. So whatever you're seeing 11, 12, 13, 14, 15, 16, 17 is all for the right teeth, and 21, 22, 23, 24, 25 is for the left teeth. Okay, so the same, the right lower and the left lower. Okay, so once you come for the practical, when you're whenever you're filling up the record, I'll tell you in detail how to fill it up. Okay, so it is FDI method is the one which is approved now, and which is followed by all the dentist doctors. So once they tell it is 4-2, it means it is right lower central incisor. If they tell it is 3-4, it means left lower premolar 1. Okay, so it is very easy. Once they tell you the number, it is very easy to tell which teeth it is. Okay, so that is a major advantage of FDI method. Okay, so this is for the temporary teeth with respect to FDI. So here you here it is 1, 2, 3, and 4. Okay, for each quadrant. In temporary tooths, it is 5, 6, 7, 8. Okay, so you add up 1, 2, 3 just in front of those numbers. For temporary, it is 5, 6, 7, 8. Okay, so this is a way how you write it for the temporary tooths. Even this slide will show you how to write it for the temporary tooths. So here you can see upper right, upper left, and lower right. Okay, for right it is right upper it is 5, left upper it is 6, left lower it is 7, and lower right is 8. Just add up 1, 2, 3, 4, 5 in front of those numbers. Okay, and even in this permanent teeth, upper right it is 1, upper left it is 2, lower left it is 3, lower right it is 4. So this is a number which is assigned, and in front of those numbers you are writing 1 to 8. Okay, Okay, this is for an example. I've just showed you how do you write the dental charting of an 8-year-old child. Okay, so in an 8-year-old child, you have the temporary tooth as well as the permanent teeth. Okay, so the permanent teeth are nothing but the central and the lateral incisor. So the central incisor in FDI it is 1 1. Okay, just see on the right side. For central incisor in FDI it is 1 1. For lateral incisor, it is 1, 2, and next is the canine. So the permanent canine will erupt at the age of it erupts at the age of 11 years, but here it is temporary canine. So temporary canine is 5 3, and you have the molar 1 and molar 2 temporary. So molar 1 and molar 2 temporary for the upper right it is 5 4 and 5 5, and you have the permanent molar 1 which is 1 6. Okay, so this is just an example how to write the FDI method for an 8-year-old child. You can just go through once, only then you will understand the FDI method and how to write the dental charting in the case of FDI method. Okay, so this I have told you on the right upper. On the left upper, it will be the same, only the number will change. It is 2 1 2 2 and 6 3 6 4 6 5 and 2 6. Okay, so this is you're supposed to write the same for any age. Even if we give you 10-year-old child, you should write the same dental charting, only the numbers will change. For 10 years, you're supposed to write the central incisor is permanent, the lateral incisor is also permanent, and again the canine will be temporary. And you have the premolar 1 and 2, which are premolar 1 and 2, it will be the permanent one, and molar 1 will be permanent. So you're supposed to write the relevant numbers which is assigned for that. Okay. So you can what you can do is you can just take different age 6 years, 7 years, 8 years, 9 years, 10 years till 12 years. You can just write the FDI charting. Okay, what are the teeth that are present, which is temporary and which is permanent. For permanent it is 1 2 3 4. For temporary it is 5 6 7 8. Okay. So this is a way how we give you for the dental examination. We give you one mandible. Just see this mandible, write the performer for the dental examination and write the dental charting. Dental charting is nothing but the FDI method which we follow. So here you can see the central incisor, the socket for central incisor which is empty. The socket for lateral incisor is empty. The canine is also empty. Once it is empty, it means it is erupted and it is fallen. Okay, and you have the premolar 1 2, and you have the molar 1 molar 2 and molar 3. So all the teeth are present and all these teeth are permanent teeth. Okay, so the dental charting for FDI method you can use 1 2 3 4 and write whenever mandible is given, write the dental charting of only lower one. Don't write the upper one because the maxilla is not there. So write the dental charting of only the mandibular, that is a lower part, that is 3 and 4. Only these two things has to be written. Okay, so once you have any confusion whether to tell whether this is temporary or permanent, so you can just, one method is you can just take the x-ray of the mandible. If it is a temporary tooth, you can see the permanent teeth in the x-ray. In the bones you can see the permanent teeth. I have shown you in the x-ray how the temporary tooth and the permanent teeth looks in the x-ray. So you can take that x-ray and see. That is a one method. One more is you can see the size of the teeth. So based on that also you can tell whether it is temporary or permanent. One more thing is once you see the temporary teeth in the jaw, just below that, if it has fallen, you can just see just below that you can see the crown of the permanent teeth. Okay, so even that is one method where you can tell whether it is temporary or permanent. Okay, so this mandible, it is more than 17 years where all the teeth are erupted. So even this is the same. So where you can see the socket for the central, lateral, canine, premolar 1, premolar 2 and molar 1 on both the sides. It has fallen and the bone is already calcified. Okay, so even that is erupted and fallen. Molar 2 you can see on the right side and molar 3. So all the teeth are erupted. Okay, and it is fallen except the right lower second molar, which you can see the teeth. All the other teeth are erupted and it is fallen. So the age is more than 17 years. Okay. Okay, this mandible is very good. Okay, so here you can see the socket for the central incisor. Just count it from the center. Central incisor you have, lateral incisor you have, canine you have, and again you have the socket for the uh, premolar 1, premolar 2, and next you have the molar 1, molar 2. Okay, molar 1 is you can see the teeth. Molar 2 socket is empty, and molar 3 on the right side you can see there is a small dent in the bone. Okay, so once you come to the college I'll show you. If you just look at inside this, so you can see the teeth that is a third molar which is present inside the bone. Okay, so once you come to the college I'll show you. In this picture you can't see it very clearly. Through this hole you can see the third molar. Okay, so that means the third molar is not erupted, it is still present within the jaw. So here the age is more than 12 years. Why more than 12? Because the second molar has erupted, and less than 15 years because the third molar has not erupted, and you don't see the spacing. You don't see the space for the third molar also. So once you see the spacing, it means it is more than 15 years. So here there is no space. Spacing is nothing but the angle of the mandible, it becomes little horizontal. Here it is little vertical. Okay, vertically the teeth can't erupt. So this angle of the mandible, normally there is a physiological change which happens in the angle, where the angle of the mandible becomes little horizontal, so that it makes a space for the third molar eruption. So this happens only after 15 years. Okay, so here since there is no spacing for the third molar, so we can conclude that it is more than 12 and less than 15 years. Okay, so this mandible is very nice. There are so many mandibles in the department, where you can also see the temporary and permanent teeth, both in the mandible. So that I will show you in the practicals once you come back. Okay, because in this it is very difficult to show you, and the interpretation is very difficult. So once you come back, that is a very small thing. So we can just show you in 5 to 10 minutes. Okay. Hope you don't have any doubts. And dental examination is very important, and it is for 10 marks. Remember, this is the only one thing which carries 10 marks. X-ray and bone is just 5 marks. X-ray is for 5 and bone is for 5. But dental examination will carry 10 marks. And the performer is also different for dental examination. Just go through in your practical record. There is separate performer, age estimation by dental examination. That performer has to be written in the exam. Okay, so this I'll conclude with the dental examination. Next class, I think I'll start up with the photograph or with the spotters. Okay, so that the practical part will be covered up. So either the photograph or the spotters will be dealt in the next class. If you have any doubts, you can ask me. Another 1 minute time. You can just message me down if you have any doubts, or you can just unmute and you can ask me directly. Hope you don't have any doubts. Okay, fine. I'll just end the session now. We'll meet in the next class. Okay. Yeah. Thank you.